Hi, I'm Dr. Dan Rubin, back with another edition of Ad Hoc with the Doc. I'm privileged to be here with my colleague, Dr. Heidi Rula. You work at Ironwood Cancer Treatment and Research Centers. We met because you and I are practicing right here together in Scottsdale, Arizona. And I know you're also at the Chandler Clinic.
Correct.
Practicing integrative oncology. I practice naturopathic oncology. You're a medical doctor, I'm a naturopathic doctor, but we do meet in the middle. And we have a lot of very similar philosophies about how to approach the person with cancer. Tell us about where you got your integrative training.
Yeah, so I started here as a family doc, trained in Arizona, University of Arizona Med School, and trained downtown Phoenix as a family doc. And it was really kind of from my experience as a family doc that I kind of understood that in order to really help people and to get at true healing, I needed to look at health in a different way than just kind of the conventional tools. So I did Dr. Weil's Integrative Fellowship at the U of A in Tucson, and it was really from there that kind of launched me into this whole world of integrative medicine. Really kind of one of the impetuses to kind of really work with cancer patients started with my own mother, who had colon cancer. She was diagnosed with a stage 4 colon cancer over 18 years ago. And I was a family doc at that time, really was not into the integrative area of health at that point. And it was my frustrations kind of working with her and being able to find different supportive services. She was really kind of more of a holistic person herself, really liked natural medicine. And
how long ago was this?
This was about 18 years ago here in the Valley.
So 2001.
Yeah, so at that time, there were very few kind of integrative type of services. And so, her medical oncologist at that time really knew nothing about how to support a patient with any of these kind of natural products, to help maybe ease the side effects of her chemotherapy or just kind of help with her overall sense of wellness going through her treatment. And so we were kind of left alone in terms of trying to kind of navigate that whole, piece of cancer care. So that, after my mother passed, kind of left me at a place where I felt that my tools that I had as a conventional doc were not going to be adequate for me to truly treat patients. And so kind of doing that integrative fellowship, I then kind of launched into being the medical director for the U of A's Integrative Health Center in downtown Phoenix. So again, that brought together a more collaborative model of healthcare.
Was that more of a family practice basis?
Yeah, it was primary care. It was an integrative primary care center. So
Which is a great background for oncology.
Correct. Right? So I mean, we had nutritionists, we had health coaches, we had chiropractors, we had
no naturopathic
No, because we were part of a study that we were trying to look at how this model could be replicated across the country. Some states didn't license naturopaths, and so they were worried that we wouldn't be able to replicate the model in other states. But certainly there was a conversation about being able to bring naturopaths in because we think that obviously that would be a wonderful part of delivering care. So at that point, no, we didn't have naturopaths, but I think it was on the wish list, of something we had. But it was really from there, after that center, we ran that for about 4 years before we lost funding, and that kind of left me into looking for kind of where I could practice, again. And I think, that calling to work with cancer patients really came through when I worked with Ironwood on, how we could start a program for them.
Yeah, when did you start over at Ironwood?
I started last May of 2018, so it's been a little over a year now.
And how have patients received you?
I think that I've been very well received. People are really they're feeling grateful to be able to have this type of service, as part of their cancer care. A lot of them were really looking for that type of support. And, previous to my joining, they didn't really have any place to go within the within the Ironwood organization. So certainly I was able to fill kind of that need for so many of those patients.
One of the things we really wanted to talk about when you and I were sort of discussing what a good topic would be is about what integration means, and that I've grown up, as a physician under the integrative model. I've been in practice. This is my 22nd year, and I've been all about integrative naturopathic oncology. And what I've been seeing is there's less fear, it seems like, from a patient perspective, bringing it up maybe to their conventional team. Yeah. Whereas before, there used to be, they were fearful. They didn't want to step on toes, or they didn't want to aggravate their conventional team. And I was always like, look, you're hiring all of us. You're the one who's bringing us on board. You're the chief. We're here to help you. Have to be honest. Always interested in transparency and protocols, those types of things. But we also luxuriously live in a state where naturopathic doctors are licensed and have a board of medicine. There's the integrative program. Not all people around the United States and the world have that luxury. And so there is still some pushback that conventionalists have towards the notion of integration. Have you felt that there's certain ways that, or figured out or talked to patients that there's certain ways that people can introduce this subject to their conventional team if they're interested in integrative oncology?
I think, obviously just asking the questions, right? And many physicians, especially in the kind of newer trained physicians who are a little bit of the younger generation, have become more and more familiar with, incorporating some of these integrative type services in. So we're seeing less resistance in, kind of the younger generation of physicians. They may have seen it in their training, programs where, in the hospital they may have had different, or clinic experiences, they may have had that. And we're just seeing that patients are utilizing integrative services kind of in record numbers compared to where they have before. So it's almost a mandate on conventional medicine to really come up to speed with what some of these services are and really looking at the data, right? Because we're seeing more and more studies to show benefit to these services and how, again, integration can really allow for, better outcomes.
It's a great point, because as an ND, I felt like it was a mandate, to use your word, that I know what is going on in the conventional world because I'm co-treating. And it didn't feel, back in the day, it wasn't reciprocated. And now with more relationships, we're getting referrals from the conventional side. I think there are certain people that they're more comfortable with it. And so it sounds like people don't need to have that fear, or they shouldn't be apprehensive. One, they need to be very open about what their intent is, what they want for their life, how they want to approach things, and also with more and more people being exposed to it, it's more of a norm.
And I think, patients are becoming a stronger voice in their own health care. And I think, obviously, with just the internet being what it is in terms of patients really now educating themselves in terms of, what kind of services are out there outside of kind of the conventional path, that, they can now have a conversation with their doctor as, that, these are some of the things they want to look at. And then they can choose, if they have a physician they feel they can collaborate with them. Maybe that physician isn't completely familiar with these services, but at least they're open to kind of exploration. Then they can kind of feel that at least they have kind of a good partnership where they can have open communication, maybe bring data from what their other team of complementary practitioners are doing, so that there is that that continuity of care. You don't want to have care delivered in these silos where you don't know what each person is doing, and there's really there can be conflict between utilizing some of these different services. So I think it's kind of finding that practitioner that you can collaborate with, right? I think that's the biggest thing. Regardless if you're using integrative services or not.
You mean you as the patient find?
Yeah, if you're a patient, you want to feel that you can be able to talk to your physician, say this is what I'm doing, have them be open to maybe they don't need to endorse what you're doing, but at least be open, to kind of bringing in some of those services or utilizing some of these other practitioners.
So I just love that you're an integrated practitioner at a big cancer center that has multiple locations, and your patients are so fortunate to be able to have access to you. But there's so many people that don't. And there's people, like I had said before, that may be sort of stuck with, and I use the word stuck with, physicians who are in silos and don't, and I hear this a lot, believe in what I do, for instance, or maybe in what you do. And I scratch my head because I don't understand where belief comes in medicine. I mean, things are or they aren't.
I think as a kind of conventionally trained physician, many of them are used to getting their information from certain sources, right? Okay. And when it comes outside of those areas, they don't feel comfortable with that information. So a lot of them, a lot of the pharmaceutical studies, they have, they're following those. Those are things, so they're comfortable with kind of the new drug recommendations that come down for treatment protocols and things like that. But when it's coming like from the nutritional literature, or it's coming from other things, these aren't areas that they really are connected with. They're not following the nutritional literature. So there may be some excellent, studies that are showing benefit, for, that specific cancer or condition that a patient is dealing with, but it may not come onto the radar of that conventional physician. So I think, when you start bringing studies from some, and maybe it's not in the type of clinical, a randomized placebo-controlled clinical, double-blinded, clinical trial is what the only type of study
the
they
holy
feel.
grail of how you get information.
And so some, if it's not coming in that type of package, they feel less comfortable with the data.
Let's talk about that, because I feel like that's still living in a silo.
Yes.
You can't just rely on double-blind placebo-controlled. You leave out any creativity. You leave out tons of N's, and what I mean by N's is people that are out there. Not everybody in those studies, in those numbers studied, come to the study exactly the same way.
Well, and I think we're finding that that model of research doesn't work for a lot of the different questions that we have. And so it's not the only way to study something. And so I think we can get some very valuable, relevant information in other types of clinical models, but we just, again, we have to be open to the fact that not every study is going to work by doing that.
Well, there's a lot of times I'll hear patients come in and say, well, my doctor said that it doesn't matter what I eat or if I exercise or not, and just go eat whatever you want, which I know that we can refute that based on study, but also we know what a human being needs to be healthy and what it takes to be healthy, and there's certain foods that just, are not supposed to be in our body.
Yeah, absolutely.
And so that brings me to the notion of research. I appreciate research. We participate in research. And I've said this before in public forum or in a lecture, because I get asked the question a lot, about what we do and where's all the research, and not every way that we approach each patient, because I still see each patient as an N of one. Each patient, regardless of their main diagnosis, still comes to that diagnosis differently. And if I don't respect that as a naturopathic oncologist, I can't give them what I think they need only. And if I only follow the literature, what literature's out there based on their cancer and the drug they're on, the person gets lost.
Yes.
And we like the person to rise above their diagnosis. And I don't think that I could truly do what they're seeking me out to do. Do you run into that, or do you have any issues with that in your work?
Well, yeah, I absolutely. I think obviously there's a lot of things that we know are beneficial, looking at mechanisms maybe of using, whether it be diet, whether it be nutritional supplementation, even mind-body therapies and things like
therapy,
that. Yeah, again, there's a lot of information that we know maybe mechanistically may be beneficial, but at this point in time, we don't have any large clinical trial to be able to support that. So, I use, that whole tier of, the more toxic, a potential therapy could be, the more data, the more strength of that information you want behind that. But if something, has low toxicity to it and potential benefit, you're going to be much more likely to utilize that therapy in a patient's care, knowing that, yes, I don't have strong data, but we have a lot of these different signs showing it might be beneficial. And I'm not going to wait until somebody funds a big study to be able to incorporate that into their care.
For the person sitting in front of you who might
needs
need
help
that
right now,
yeah,
right?
Absolutely. Well said. Dr. Rula, the definition of integrative medicine, since you sit on many committees and groups and you're helping to define this, please share that with us.
Yeah, integrative medicine really is kind of this evolving field that is now, trying to be able to have a true definition to say, who truly is, an integrative medicine doctor and this is more a definition for people within the kind of conventionally trained pathway. So there's a lot of, naturopaths are integrative, and there's lots of, practitioners who all kind of work within this field of integration. But in terms of, an integrative medicine seasoned physician along the conventional training path, we're looking now to have somebody who has some fellowship training behind, this, not just saying that they did a weekend course here or there and, are utilizing different supplements and, and other complementary therapies as part of the way they deliver care, but that they really have had some type of comprehensive training to be able to bring all these things together in a place where, again, it comes from a point of being, trained how to do this.
Got it.
So we really like to see the fellowship component, and we really want, those physicians to be practicing in a way that is holistic, right? Looking at that whole person care, the mind, body, spirit is a really important part. And so, being able to address lifestyle, it's not just, I use supplements, so I'm a integrative physician. Right. It's really kind of, being able to say, we need to look at the whole component of lifestyle, bringing in other healing systems as part, of how we deliver care.
Is it becoming a specialty?
Yes, well, there's now a board to be fellowship trained in integrative medicine, and part of the board requirements, are that you have completed one of these fellowship training programs. So, you can be board certified in integrative medicine. So that can also be a way to look at your conventional doc to see whether or not they truly meet that criteria.
I think it's wonderful because it's another meeting place for naturopathic medicine and conventional medicine, and I think the language is it's more common and it's easier communication, and it's just been wonderful. It's been wonderful for patient care.
Yeah, and I think utilizing the fellowship kind of model. I mean, they're incorporating kind of naturopathic physicians as part of that training, so that again it becomes more collaborative. It's not conventional versus naturopathic. I think that we each play a valuable role in patient care delivery, and acknowledging that kind of more team approach to health is, I think, the way healthcare is moving.
Yeah, and Dr. Al Schuler, who's we've practiced together and have for years, is on staff at U of A at the integrative program. And
yes, absolutely. She's
example.
A valuable resource to all of our, all of our fellows who are going through this training.
Regarding internet information, I often tell my patients it's okay to get information off the internet, but as long as you bring it to me, especially something relevant to treatment change or decisions you want to make. And a lot of people will send us information or send us emails and ask us questions. And I certainly ask them to be respectful of our time and our staff's time, because we can only answer so many things responsibly and respectfully. Then anytime they ask us a question, we are responsible for their care, right? And there's a lot of stuff on the internet that I just don't think is worth very much. And then there's a lot that is worth a lot and can really help them. And so I do respect that if they would bring that in, or if they would preempt their visit with questions that they may have or things that they're interested in or taking a look at. How do you handle that in your practice?
Well, I mean, I certainly have the same experience, where patients on a daily basis are bringing in things that they have found on the internet. And so many friends and family are trying to do good, for their loved ones, to say, please take this. I heard that it cures cancer. And so patients are bringing in all these different sources of information and saying, does this really work, right? So, I mean, I think that's an important question, to have, some type of health professional help you navigate the literature of like where these sources are coming from and what is the true data. Because I think a lot of times if you don't have any kind of background in being able to evaluate some of these information sources and, what kind of data is behind it, and understanding maybe some of the safety issues that go behind that, you certainly can either, be venturing into something that could be very toxic, that could interfere with kind of what your, current care is, or it could be very expensive and really, give you no benefit other than, making you a little poor, right? So, but I mean, I think utilizing some of the sources, when a patient maybe doesn't have the professional to kind of work with, I mean, certainly Memorial Sloan Kettering, they have a integrative oncology program there where they've created on their site, ways to look at some of these different natural products, the evidence behind them.
It's
something they can look at. I mean, they get some of these, therapies that are being recommended. I mean, if so many patients who are on B17 or, the apricot seeds, come in and say, I'm taking this, is this okay? And I'm like, go look on there and they'll tell you, like, these are all the studies behind behind, why you probably do not want to do this.
Or if it's legal in the United States.
Exactly. So, and hydrogen peroxide therapy. I mean, you can look it up and you can kind of see what, what is the true evidence behind that, where, somebody has evaluated it from a standpoint of, okay, let's really look at the evidence and not just say, we have a couple of case reports of this curing somebody, so now let's utilize it, right?
Well, thank you so much. This has been really informative. And I was wondering if you had 3 tips or more for somebody who isn't yet but is interested in integrating their care as a patient, what would 3 of those tips be?
Yeah, I think number 1, start out with your current physician, whether it be your oncologist or your primary care doc, and talk to them about your interest in being able to utilize maybe some of these other health systems or complementary programs. So getting an understanding of where their position is on that, and seeing whether or not you can have some type of collaborative relationship on kind of bringing some of these things together. So I think certainly that's helpful. I think that, doing a little bit of your own research, maybe, connecting with somebody in your community that, is offering some of those integrative things, certainly that can help you, be able to kind of figure out if this is a direction you want to go. So, I think those would be the 2 things to kind of start with.
Well, thank you for being here. I appreciate it. And for another episode of Ad Hoc with the Doc, this is Dr. Dan Rubin and Dr. Heidi Rula.
Thank you.
Thank you.